January 2024. Happy New Year. I'm Lynn Miller. I'm the NP clinical lead, and I work with Deb Fraser as part of the program leadership team. I guess that's our official title. I've been with Athabasca. Well, I went to school here and I graduated with my master's from Athabasca many years ago, and have been thrilled to be either acting as a sessional instructor, and then most recently I have a half-time faculty position, and I get to do the clinical piece of it, which I truly enjoy doing because I get to meet all of you eventually some way, somehow. There's a couple of members of the team here, and Deb, do you want to just say hi briefly while you're here?
Sure, I can do that.
Yeah.
Hi,
okay,
everyone.
Cool. Thank you.
Thanks for joining. As you know from the announcements, there's also a general town hall on Wednesday. So keep your general questions for then, so we can keep this focused on clinical related things. And it's great to see so many of you here, and I'm glad that this many are planning their practicum. It's excellent to see, because certainly you're well needed out there. So let's see if we can get you through in a timely way and get you into practice where you can make a difference.
Exactly. Thanks, Deb. And that's absolutely true. I think there's been no time like the last 2 or 3 years where the NP rule is exploding, and there's huge changes happening in every province. So it's exciting that, you know, you'll be able to get out and practice and really make a big contribution. And that's our goal, is to support you to get through this. Okay, so, and if, and we didn't turn that on. If you're not, I ask everybody to mute their microphones for me, thanks. Sue, do you want to say hi quick? So Sue McKenzie is a member of the team, and you folks East Ontario and East will recognize the name. So here's her pretty face.
Hi, everyone. As Lynn has said, I am the clinical placement coordinator for the East. So anyone in Ontario or the Maritimes, Atlantic provinces, I'm your person. And you've all been keeping me very, very busy. Both myself and Sherry, my counterpart out west. So there are lots and lots of things happening, and as Lynn alluded to, lots and lots of changes, and we're certainly doing our best to keep track and keep on task. And if there's ever anything that we need from you, we will certainly contact you directly. So no worries, we're keeping apprised of everything as it changes. Over to you, Lynn.
Thanks, Sue. So Sherry Jansen, as Sue mentioned, is the Western Canadian Clinical Placement Coordinator, so she couldn't be here tonight. And Janice Young, who is the Typhon Guru. So you hopefully have watched the videos that Janice posts to help you with Typhon. She couldn't be here this evening either, but she is, she's there to help if you run into problems with Typhon. But I guarantee you, the first thing she's going to say is, did you watch the videos? So I'd strongly urge you, before you reach out, to watch the videos, because I think a lot of your questions will be answered. Confession, if I need to do something in Typhon, I go watch Janice's videos because they're that good. So so there's, I think Sandy's here. One of our clinical instructor team is here. Sandy, do you want to just pop on and wave so we can see your face? Say hi.
Yep, just got to get the camera back on again.
There we go. There's Sandy.
Oh, there. Oh, that. See, the feed is really bad.
It's pixelated. Yeah. Interesting.
Mm-hmm.
So there's Sandy.
I'm Sandy. I'm one of the clinical instructors for this course. I live out west in Alberta, but I've got students from all over the country, so that's kind of nice to see. So it'll be interesting.
Welcome, Sandy.
Yeah, I've taught with the program for many years now, but this is the first clinical course, so this is good. It's exciting.
Yeah, this is great. I'm thrilled you're with the team. And Shelley just popped on.
Hi. Hi, Lynn. Hi, everybody. I'm Shelley Walkerly. I'm one of the instructors for 676. I've done it a few times now. Been at Athabasca for a couple of years. So looking forward to the term.
Thanks for being here, Shelley. And
Trouble.
I can't see the list, so I'm not sure who else of the instructor team is here. If you're here, pop your camera on and just wave, and then we'll continue. Maybe that's all that managed to make it. Okay. So as soon as I flip on the PowerPoint, I'm not going to be able to see folks. So if you have questions, kind of just like make little notes, and we can connect when I'm finished. So can you see my PowerPoint? Is it showing up? If somebody can let me know.
All
Thank
good.
you.
All good? Okay. All right. So, as we say, purpose tonight is to walk through the clinical process. And before we start, we've had great discussion, very much a philosophical discussion in many venues where I am about land acknowledgements. And I think it's very important. I had a friend comment that he has Aboriginal friends who are of mixed views about whether or not the land acknowledgement is meaningful, and they encourage us more to reflect on the lands where we live and give thanks to the peoples that came before us, and in that way is the respectful land acknowledgement. So in many meetings I'm in on, usually what we'll say is think of where you are and the traditional lands upon which you live and work. Athabasca is on the traditional lands of many Indigenous peoples, the Inuit, the First Nations, and the Métis. And together with those folks, we honor that ancestry and heritage and the gifts that they've given us. I'm in Nova Scotia, so I'm on the unceded lands of the Mi'kmaq. And I know there's a whole bunch of us from Nova Scotia. The Mi'kmaq territory extends through a good deal of the Maritimes, but in Nova Scotia, there's one huge landmark. There's a huge Glooscap statue that you pass when you're driving towards Halifax. And I always think when I'm on this land, you know, what a beautiful place. And I wonder what it ever looked like before all the commercialism and, you know, the asphalt came in and moved in. But it's a beautiful piece of land, and everywhere in Canada is a beautiful piece of land. So think and give thanks. That's the important message with these. So just a couple of general reminders, and these are important things to keep communication flowing easily and fluidly and consistently. So please, you always need to use your AU email with us. It's university policy, but it also prevents things from getting lost or misdirected into, say, our spam folders. So personal emails can't be used for that reason. It will also speed up ensuring that we do get the messages on time from you. Okay, so if you don't have an AU email or you're having any trouble with the AU email, you'll need to reach out to the help desk and they can help you get that set up or moving forward. You're responsible also for reviewing the NP student handbook and the NP clinical practicum guide. So for those of you that have been around for a while, this used to be one big book or one big resource. We've since split them apart. So there's a bit of mention of clinical stuff in the NP student handbook, but the clinical practicum guide governs everything you need to know for 675, 676, and 678. It's updated as needed. So, you know, the other thing is I encourage you not to print it off, but if you need it, please refer to the link so that you make sure that you have the latest and greatest version. Deadlines, yeah, they're a thing. And these deadlines are in the NP Clinical Practicum Guide as it pertains to the clinical courses. You have to think of things like exams for all the other NP courses, registration dates, drop dates, assignments, preceptor request forms, the clinical prerequisites, all of those things have deadlines, and they're there for a reason, because we have obligations to some of the outside parties, to preceptors, to different clinical sites, some of which have their own deadline system if you're going through like a health authority facility. So it's important to know them, and it's important to make sure you meet those deadlines, because if not, we sometimes have no way to get a delayed application or to get forms put in after their due dates. They may not be accepted. And as Deb said, we want to get you out and get you working. So we don't want you delayed in moving forward. Those deadlines are your responsibility to be sure that you're aware of and that you adhere to. And we'll talk a little bit more about some of the specific ones. The other thing I always like to remind students, that if you find that you're struggling with things, getting organized for school, if there's different personal stressors, family stressors, work stressors, school stressors, there's great resources with Athabasca. Access Services and the Counseling Center are two great examples. And the counseling folks are there for things like writing exams, exam stress. They can help you organize your study habits, things like that. Access Services, you have to register ahead of time. And these would be the people that look after things like any special accommodations. So if you needed more time to write an exam or anything special for completing the clinical experience, something like that, you need to reach out to Access Services early. And any accommodations need to be confirmed by the second week of each semester. So if that falls to you, just please keep in mind that's another deadline brought in from another department at the university. So the clinical team, Deb's here, myself, Sue, and we mentioned Sherry and Janice. Ev Mitten is the administrative professional officer, so she keeps us organized. She does so much for the program behind the scenes, as well as kind of out front representing the admin side. Janice D, and you've probably all had contact with Janice, is the academic student advisor. So she helps organize grad programs, helps people wondering about what order to take courses, different aspects of the program. And then Erin, and I left Sarah's name here. Sarah's actually with us kind of part-time on contract business, but she's an important member of the team. Erin and Sarah do a lot of the clinical practicum work. So Erin, you may have heard her name talking with you about prerequisite requirements and things like that. So that's who you will reach out to if you need help. You can always, if it's a course related issue, please talk to your course instructor. If it's specifically related to a clinical practicum, please reach out first to Sue or Sherry, whoever would be your specific person for your part of Canada. And they will be able to help get answers. If they need to pull me in, then they'll pull me in after the fact. So this, I think, speaks to that last slide. Make sure that you're emailing the appropriate people. If you have a concern about a preceptor, if you have concern about some piece of the process, please talk to the clinical placement coordinators or myself first. That's the professional way to do this. You know, it's not really appropriate to be taking it outside of the clinical program at this point. You know, it doesn't need to go to higher level people within the university and all, because they wouldn't have context to this. So if you reach out to Sue or Sherry or myself, if you have any specific issues, we're happy to help. Please make sure too that you go through all the policies and guidelines and procedures. So things like appeals, we talked about deadlines, application processes, things like if you needed an extension on a course, something like that. They all can be found in the policy manual online in the graduate, on the grad web page. And it's helpful, especially if you're reaching out to me, if there's a specific question, Please include your student number and your course number for sure. If this is one of the clinical courses, please let me know which semester you're in. Are you in the first or the second semester? And that helps me if I'm trying to find you in the list of students or kind of speak to the context of your specific question, if I know which course you're in and which semester of that course. So those of you that are just starting out, this is a really exciting time and I welcome you on board. For those of you that are working your way already through the clinical practicum experience, again, welcome back. And I'm hoping that you're finding this a very valuable learning experience. The purpose of clinical is to make that role transformation from RN to NP through integrating theory into practice. So what you've brought forward from your RN life, as well as what you learn in the life stage courses in the program, is here applied to real patients in real time with the support of a preceptor, so a nurse practitioner or a physician. This is your time to learn in a safe environment. It's the time to ask questions. It's the time to feel that you've got someone there to support you as you learn. And this engagement in direct patient care experiences gives you the opportunity to assess and diagnose and manage patients from basically across the lifespan, from birth to death, and all types of presentations. So well patients, and nurse practitioners are known for that health promotion, health maintenance approach to care. So those healthy patients, although unfortunately with, pressures on the system, some of that health maintenance, getting a checkup stuff seems to have fallen by the side. It's important to get that health promotion bit in every patient encounter. We also look after acute health concerns and chronic disease management, and that's become huge, even bigger than when I went through the program 20 years ago. So that's where you can have such a great impact, is even people with chronic disease can live healthy, and that's part of our role. This theory to practice experience in clinical also gives you a way to develop those critical thinking skills, leadership skills, collaboration with other members of the team that you're working with, as well as your classmates. Helps you develop advocacy skills with your patients, and perhaps even with some of the things that you're seeing in the clinic setting. And then it helps you learn to do some research. So all of these competencies that are part of NP practice are integrated into the life stage courses, but also here in the clinical courses. So this is the structure. And for those of you who are just starting out on your journey in clinical, this is how it breaks down. There's 800 hours divided over 3 courses. So 675 and 676 are 250 hours each, and that's minimum. You can do, you may need to do more, or you can sometimes do a few extra hours if you have the opportunity and you think it's going to support your learning. Needs to be approved because there's always contract pieces to this with preceptors and facilities. So if you think you want to do a few extra or have the opportunity to do a few extra, you've got to check with Sue and Sherry. And they will make sure that all of that is going to be agreeable with the place where you're doing your practice. Nursing 678 is the consolidation course, and it's 300 hours minimum. And no matter how many hours you have going into that last course, if you've accumulated a few extra in the first 2 courses, you still have to complete 300 hours in nursing 678. And that's basically in policy from the organization at the regulatory body in Alberta that regulates our program. You can have at this point up to 2 consecutive semesters to complete each clinical course. And some people opt to do this because they may still be having to work part-time. It gives the opportunity to give you some flexibility to manage your work-life balance and to have time for family. But keep in mind, if you reach the end of that second semester and you have not completed those required hours, anything beyond that, you need to apply for a course extension, and that's when extra fees kick in. So 675 is that first foundational clinical course. It gives you the chance to learn all the stuff from advanced health assessment and pathopharm, and then whatever life stage courses you've done, and to get your feet wet. I have a comment here about specialty placements. So students can have the opportunity to do one 80-hour placement in, a different area. You don't have to, but some people have an opportunity if they choose to. We really encourage you, if you can, not to plan that during 675, because we want you to get your foundational skills well grounded in that course. 676 is that second integrated course. And again, you're building on what you've done in the first clinical course, as well as whatever additional theory courses you've completed. As you evolve through these three courses, the idea is you become more of an active leader in patient care, and you're taking on more and more of the patient care responsibilities. When you get to 678, that's when ideally, and I think I cover this a little bit later in more detail, but ideally you are taking on a leadership role and doing a lot of that patient care independently. Sounds a bit scary, and it can be a little bit intimidating, but the evolution process through these three clinical courses with the support of your theory course is going to prepare you to be able to do this. And by the end of 678, the idea is that you are basically ready to go into independent NP practice. So within each clinical course, the other piece to keep in mind is Athabasca's program requires that you have a minimum of 100 hours for each population group. So women would be 18 years and over, and that's more specific to women's health, reproductive health issues, right through from, period counseling for, as for teenagers, contraception, maternity care. There's important skills on the skills list in TIFIN that include monitoring pregnancy, assessing fetal heart, all of those important things, because in primary care, you can do a lot of prenatal. That's part of that population. Pediatrics is 17 years and younger. Adults is anyone 18 to 64, men or women, and then older adults, 65 and older. Nursing 675 is completed either concurrently or after nursing 526, which is adult health. And that ideally is the first life stage course that you have taken or will plan to take. 678 is completed either concurrently or after nursing 530, that last theory course. So those are the two bookends. After 526, the order of the theory course is at your discretion. And, those opportunities may be something of interest to you, or you may have an opportunity perhaps to do, say, some pediatric clinical. So it'd be great to line up the theory course at the same time. So do 524. We do strongly encourage you to avoid front loading the theory courses, which means doing all the theory courses and then do your clinical. There's been a couple of extreme circumstances where that's happened, and I'll be honest, students found it hard to do all that theory and not have the opportunity to do clinical, to kind of bring all that information together and do that knowledge transfer. So what we usually encourage you to do is, either do a theory course along with a portion of a clinical course, or one after the other, so that you've got that opportunity to integrate all the knowledge together. Your clinical, believe it or not, too, makes the theory courses have more meaning. So it's really important that they're set up together. Talk to Sherry and Sue, or talk to Janice DG about that piece of it. And I'm happy to talk to you as well. But those three folks would be your best advisors to help you set things up. Or Deb. So another couple of things about the clinical courses, hours can only be completed during the established semester dates. And I want to dispel, I know there's lots of chatter and there's been rumors about past opportunities for extensions and people can have an extra 2 weeks and all. That's not possible. There's always exceptions, and in extreme circumstances, sometimes we can entertain that. But there's deadlines within the admin office and the registrar's team, and those deadlines need to be adhered to as much as possible. So aim for that last official day of the semester to have your clinical hours done, whichever or however many you plan to do. We also can't do clinical hours between semesters, just for faculty coverage and workers' compensation. The fact that you're not officially registered in a course, there's a lot of liability things there. You must, and I don't like to yell at people by bold and capitals, but I need to do this. You must receive email confirmation from your clinical placement coordinator that everything is in order before you start your practicum experience. Sue and Sherry will send you an email basically saying you're good to go with the parameters around the practice, where you are, all of that information. Without that, you know, you're not in an approved placement. And again, that creates liability for you, for your patients, for the organization, and for the university. So any hours that you accumulate without that placement, without that confirmation, I'm sorry, won't be counted towards your course total. And there is potential for academic consequences. This information is provided everywhere in the NP guides. We talk about it here. So it's critical that you keep in mind, until you get that confirmation email from your clinical placement coordinator, you should not be in the clinical practice setting. Okay, and if you have questions about that, please talk to them. It's very clear what the email is like. It's there's no question. This is your confirmation of your placement. So until you receive that, don't be working with your preceptor. Alternative hours are used to give you an opportunity to count time that you spend with your preceptor that may not be related to a specific patient, but it's related to patient care in the clinic setting. So I'm thinking of an example. Your preceptor may say to you, you know what, I know you weren't here on Tuesday, but I saw this really interesting patient and I think it might be useful. So let's go through this together, that type of thing. You can count up to 30 alternative hours per course, but they can't be carried over. So whatever you don't use in a specific course, they can't be carried over to the next one. Maximum 30. You can accumulate as many as you like, and you can log them in Typhon because it doesn't hurt to keep track, but you can only apply 30 toward that course total of either 250 or 300 hours, depending what course you're in. And please put what that activity was in Typhon, because where it's not clinical with a patient log attached to it, we want to be able to know what you did with that time. Some of the things that cannot be counted as alternative hours are things like professional development, conferences, workshops, team meetings, pharmaceutical meetings, journal clubs. They're all important learning opportunities. However, they can't be counted because they don't directly apply to clinic. So Janice has spoken about this, and there's more detail in the NP Clinical Practicum Guide if you have questions about what can count. But Janice did a video about alternative hours that hopefully will help sort that out for you as well. The clinical experience is guided by a clinical learning plan. And for those of you that have either completed courses already or have been in and had a look at things, this clinical learning plan, there's a template in each course, and it's something that will guide you through not only this course, but it'll help you build as your program moves forward. The For those of you, and I'll just mention this, for those of you who are in a second semester of 2 for a clinical course, please have a look at your clinical learning plan, see if it needs to be altered, see if you can, add a goal or alter one of the goals that you've had as a way to keep the momentum moving forward with your learning. If you have, and you probably will have a different instructor if you're in that second semester, you're in the carryover group. So communicate, please, with whoever your clinical instructor is for the second semester on what they would like to have as far as that clinical learning plan. They may ask you to repost it to review it, or if give you the opportunity to buff it up a little bit. As you plan your clinical experience, I've included just some estimated or suggested number of clients to shoot for every day. So if you're in a busy practice, the idea is you're not seeing maybe all 30 patients that your preceptor sees. Ideally, what you'll do is see a kind of, the ones that may provide you with the best learning. So, choose those that are going to give you a chance to practice physical assessment skills and maybe more critical thinking, bringing multiple presentation pieces in together. In the first course, think about 8 to 10 patients a day. In the second, beef that up 10 to 12 clients a day. And then by the end of 6, 7, 8, you should be able to manage 12 to 15, even maybe a couple more, depending on what they're there for. These are guidelines, remember. But if you're seeing 35 patients a day in your first semester of 6, 7, 5, there'll be questions asked to say, like, are you really learning? And if you're only seeing 4 or 5 a day in 6, 7, 8, you may also be questioned as well. We'd need to know the context of the facility. And in some, that might be appropriate. But as you set up your clinical placements, try to keep in mind that this is primary care right now that the program is based on. And we want you to be seeing as many of those birth to death, all populations type of patients within primary care. So that's what's going to optimize your learning and prepare you to write and pass the licensure exam and then get out and practice. It's very important to note that you can only work with your preceptor in approved settings, and your preceptor must be in the clinic with you. So they can't be on a different floor or on a different unit. They need to be there with you. And you cannot work with another provider that's not listed on your PRF. Again, liability issues there. So that's what those preceptor request forms are there. Now, Sue, when we're finished, I'll get you to clarify the one thing about this. There may be times that there's more than one preceptor in a group practice that's listed on your PRF. That type of detail can be noted, but you can't kind of go off on a day to work with a different person if your preceptor's sick or something like that. They have to be listed because there's contractual issues that we have to maintain. Also, keep in mind that clinical hours and patient logs have to be entered into Typhon within 72 hours of that clinic day, or they won't count. It has to be entered. It needs to be done in a timely manner so those can be monitored. But it's not a useful way for your learning or to track your client experiences if you're doing it, a month or 6 weeks after the fact. So after 72 hours, those days will be locked and you will not be able to backtrack beyond 72 hours. So, and this part of the presentation, I always wonder which needs to come first because it's not always linear, this process piece. Before you start, clinical placement process takes about 6 months for Sue and Sherry and all the folks around that support this to put it in place. So you must submit a preceptor request form no later than 6 months prior to when you want to start. Deadlines then are like March 1st for the fall, July 1st for winter, November 1st for spring. So we're coming up now on that March 1st deadline, which for anybody planning to do clinical in the fall. you need to start thinking about that PRF. And PRFs need to be submitted each semester for each preceptor and each site, even if it is the second of 2 semesters of the course. So if you're taking 676 and January, this is your first semester of 676, and you plan to do it over 2 semesters, you would have submitted the PRF for this semester back on July 1st. But you also should have submitted a PRF for spring back on November 1st. That gives Sue and Sherry time to make sure the facility contracts are in place. Even if it's the same preceptor, you still need to have those forms submitted for each separate semester. And that's one that sometimes gets forgotten, unfortunately. So that's why I've done the bold and capitals here too. I'm not yelling at you. I'm just trying to make it stand out. There's also a list of prerequisite documents here, and that's what Erin helps with. I'm not going to read through all these. This is in the NP Clinical Practicum Guide. But please make sure that you have these completed and ready to go. Again, these have to be in place before you start clinical. Some of this I think we covered already. The important thing also to note here, your evaluations need to be submitted after each 80 hours of clinical time. So think of those progressive evaluations as an assignment. There's not a due date like, you know, February 15th or something like there would be for a written paper. The onus is on you to know when you're at about that 80-hour mark to submit the clinical evaluation. If you get to 200 hours completed in the program and you have yet to complete a clinical evaluation, there's risk that some of those hours may be lost, especially if there's been any problems identified by your preceptor. By doing it every 80 hours, it kind of gives us a chance to evaluate your progress, look at the learning plan, see if there's anything you need to focus on, and then you've got time in the rest of those clinical hours to make those changes. So approximately 80 hours. When you submit an evaluation, the case log total, graphical report, and your progressive clinical evaluation form need to be submitted together, and that typing report needs to be initiated by the preceptor. The time log is going to show alternative hours as well as that case log total, and the case log total is what reflects the patient care. A final evaluation is completed when that minimum 250 hours have been completed. And it's helpful if the Typhon forms submit like for the whole course, so we can get a picture of all the skills you've done, of all the hours you've completed, how it's been broken down. Oops. Sorry, guys. And I did have a bullet somewhere about the skills list, but in Typhon, you'll find the skills list for all of the things that we expect you to be competently able to perform by the time you complete the program. They'll start like as observe, and observing is fine in 675. There may be many things that you need to observe, like maybe the first time you do a lesion removal or a pap test or something like that. The expectation, however, as you move forward in the program, is that you're going to take on more of the student participation greater than 50%. So you're doing the bulk of the care. If it's something you've never done before, or in 675, don't be surprised if your preceptor is in the room with you to observe you do even basic health assessment. If it's something you've never done before, ask your preceptor to be there with you, to have some guidance. That's that safe learning environment. But as you work through the program, the complexity of the patients should be increasing and evolving, as well as the balance between you doing the bulk of the patient care and just using the preceptor kind of as a consultant. That way, that independent, that advanced practice, that's how you get your skills to be an independent practitioner by the end of the program. So Typhon that you've heard me talk about, and those of you that are new to the course, this is our it's basically the student tracking system. It allows us to track clinical hours for the program, but it's also a place where many of the forms that you need will be found. It can also act as a place we store a lot of documents there. So if there's a specific letter about an exceptional need for a clinical placement, or if something's happened that you need a bit of a time away, we keep track of all those documents within Typhon because it keeps everything related to clinical in one place. The skills record is there as well. And the beauty of this system is if you keep this up to date, you enter all the skills you've done, and you enter, don't just do every skill once. If you've done something with 10 visits, check it off when you enter that patient information every single time. These have become very useful tools when you apply for a job, because they can become, well, as we said here in ePortfolio, they can become like an appendix to a resume to say, you know what, I have a specific interest in a certain patient population. And look, here in my clinical practicum in my program, I did, I concentrated on these skills. I've really developed these skills. This can be your proof, because this has been signed off by your preceptor and it's been looked at by your instructor and all. So it can become a really good tool out in a very competitive job market right now. So there's Janice's email, and it's also posted in all the courses in her videos. And she asks also for name, student ID, and your AU email when you reach out to her if you need any help. So for those of you who are in 6, 7, 8, the light at the end of the tunnel is getting brighter. That's the analogy we always seem to use. When all of your clinical hours are finished, the documents need to be submitted to have them audited. And this is required. It's like the final passing piece for the clinical part of your program. It's critical that you keep all original signed evaluations. You may want to have paper copies, but you also may want to scan them and save them in the cloud somewhere, just so that nothing happens. We've had students who've suffered losses from, floods and house fires, and their documents were gone. So in this day, keep an electronic copy somewhere. And there is a specific approach to submitting the audit that's found in Typhon. The folks that do the audits will send them back if it doesn't appear as instructed. So things like when you submit your progressive evaluations, it should be one scanned PDF document, not like a series of 15 photographs that you've taken with your cell phone. That will be sent back. So if you run through those instructions and apply those all the way throughout the program, putting your program audit package together will not be difficult. And questions. So I'm going to stop sharing, and then we can, maybe if people have questions and they want to open it up. We've got a couple of minutes here. If anybody has any questions, why don't you pop your camera on and we can see if there's anything we can help you with. Dana.
Hi.
Hi.
I just sorry. The CRNA document that is linked in our forms for the competent entry to practice competencies, the link doesn't seem to be working, and it looks like they're have a new draft for this year. So I'm just not sure which you would like us to use for our clinical learning plans.
For now, use the 2016 version, please.
It won't, oh, I can't get it to open.
Okay, I'll try. That was working earlier, but I will try again. Deb, do you know, have they taken down the old one off the site? I pulled it the other day.
I suspect they probably have. They often do when they have a new version.
Yeah.
So the program at this point is still based on the 2016 competencies. It's 2026 when they anticipate having a new exam. So we're still working from the 2016 competencies at this point in time. And CRNA is aware of that and have approved that process for us.
Yeah. So Danny, you know what I'll do? I'm sure I have a PDF copy of that document. I will post that in the course for folks.
Thank you.
Yeah, no problem. Thanks for pointing that out, because it's one of those things like and it's probably the timing of their approval and links going down. So thanks for letting me know. All right, there was another hand up, sorry. Kristen, hi.
Hi, so if you want a progressive evaluation at 80 hours, does that matter if it's like when it happens, if we're doing it over 2 terms? Like 80 regardless if it's on 1 term or 2, or would you want it?
Good question.
Does that make sense?
Yeah, no, it does, because, and you know what, over the 250 hours, you don't have to do 125 in the first term and 125 in the second term. Some people might do 170 and 90. They might do 100 in the first and 200 in the second. It's important to get that evaluation if you're crossing into the second semester and you're not working with the same preceptor in the second semester. It's going to be absolutely critical to get a progressive evaluation from that preceptor in order for those hours to count, because it has to match up.
Okay.
Yeah. So you might be, if you're with preceptor A in your first semester and you know you're only going to do like maybe 120 or 130 hours with them, I'd get a progressive one at 80 and then get another progressive at the end of the semester so that you can tie all of that up together. And it's always good to do it anyway, because sometimes you can't predict. You may plan to work with the same preceptor in the second semester, and if something happens to that placement, you'd have no mechanism to have the hours signed off by them that matches up. They have to match with what's in Typhon.
Okay.
Does that make sense?
Yeah, it's just hard if you're not really like planning out your hours, like 125 and 125. It's just like, where do you put that evaluation, especially if something happens to them over like the second term and they
Over the
can't be your
second semester.
preceptor.
Yeah. So do the first one at about 80.
Okay.
And then if, when you're coming to the end of the semester, it doesn't hurt to do another progressive evaluation. I mean, you may end up with more, like if you think 250 hours, you'd have roughly 3.
Yeah.
Right. But sometimes folks will do like, we have the opportunity to do 40 hours with midwives. So you'd want one for that 40-hour experience as well. So you may have second one, you may have a 40-hour one. They don't have to be 80.
Okay.
But at least, at around 80, we've determined that's 10 shifts. So within 10 shifts, your preceptor should get a good idea of things that are going well and things that you need to improve on.
Okay.
Okay. Good question. Thank you. So I'm watching Sue, you're answering stuff. Victoria, go ahead. Oh, you're muted.
Thank you.
No problem.
I'm just wondering if we could clarify or kind of just review, when we have 2 preceptors and you want it at 80 hours, is it when we hit the 80-hour threshold based off of preceptors or as a collective?
That's always a complicated question.
My second question is how do we submit evaluations? Does each person submit their own and then I just scan all the documents into one and then submit?
That's always a bit of a dance, because ideally you want enough time for each preceptor to see you and see how you perform. So sometimes if they're in the same clinic, some students have, so then I'd say do one at 80 for each separate one. Yeah. And even if you have 2 preceptors and they're in the same clinic, they each need to fill out their own. Like they can't double sign on the same one, or one of them. I've had them submitted with one person puts an initial and the other one puts a check mark and all that. That doesn't apply. You need 2 separate forms.
But do you want them all scanned in and then submitted at the same? It's just hard because like if I'm only working, let's say 70% of the time with one and 30 the other, they're going to hit at different times.
You do it at different times.
Okay.
Yeah.
Okay.
I just don't want it to get to the end. I've had students who've gotten to the end and submitted like at 220 hours, and that's the first time we see an evaluation.
100%.
yeah, the idea being if we can help support you with things that need to be worked on, if we can identify it early, we're there to support you. I just really feel bad when I find out somebody's been struggling and they've only got 20 or 30 hours left of a course, because then that's going to involve them having to repeat, right?
Okay.
So, yeah, thank you.
Perfect. Thank you so much.
I don't know who was next. Carly, I think maybe you. Go ahead.
I was on, and then it looked like the last person had the same question I had. And then I
Okay,
thought
so are
it
you
was
good?
answered. But then I have another question, because she
Okay.
mentioned that her preceptors are in 2 different places. So mine are in the same clinic. So if I've got, 60 hours with one and only 20 hours with the other, I know they're on separate evaluations. Do I wait until I've got the other 80 hours with the other person? Or I might not get 80 with the other person at all.
Sometimes in those cases, sometimes what I've done, students have actually sat down and had a discussion with everybody together and still submit them separately.
Okay, so it's okay if like the 2 evaluations equal 80 together?
That's fine, but they
Okay.
just need to be 2 separate pieces of paper if you're comfortable that everybody can sit around together. And
Yeah.
sometimes that's good because it's good learning for you to see different people's impression of what you're doing, right?
Yeah.
That's a really good way to collaborate. So if you can do that, that would be fine.
Okay, I'm not too worried about the one preceptor in specific. He's been my same preceptor for the last 6 months, and he's my preceptor for this time around too. But now I've got a new NP preceptor as well. So this will
Okay.
be the first time.
Yeah.
And I'm going to be primarily with her. So, okay, that sounds good.
All right. Cool. All right. Thanks. Lori.
I think you might have answered part of my question, but I just wanted to clarify. So my first part of my placement, I did 100 hours in a hospital with a doctor. When she did my evaluation, it was listed as a final because it was under 100 hours, and that's what our instructor had told us to put in. So now this semester I'm with a nurse practitioner for the other 150 hours. So I would do a progressive one around 80 and then the final at the end, or should I do 2 progressive?
No, I mean, I do the idea of the final one, it would be the last one in the course. So at the 250 mark. The one that you did last semester with your other preceptor, I mean, it's the same form. It's just what do you select it to be? It just as well could have been a progressive evaluation as well. That piece, I don't really care what it's labeled as much. The only issue is it gets put in the Dropbox and then the Dropbox gets jammed up. So, yeah, don't worry about the last semester. And then this time around, if you're doing 150, you may want to aim, somewhere around 70 or 80 hours to do a progressive. And then the one at the end would be a final.
Okay, perfect. Thank you.
Okay, no problem. All right, we've got about 5 minutes. How are we doing? Because I can't see chat.
I have another quick question about the skills list.
Yes.
For auditing purposes and graduation, is there a specific number of times you have to have completed a certain skill in order to graduate?
We want everything to be completed at least once.
Okay.
But if you do, I don't know, 5 cage questionnaires or 5 MOCAs or 5 rectal exams or whatever, check it off each time. Like as you're entering the information for each client encounter, it gives you the opportunity to go and check off the skills list.
Okay.
So do that and it will accumulate. And like I said, that's the piece that looks really good. If you have a specific area of interest and you're looking for a job somewhere and say, well, look, I have done, however many of whatever such a skill. It's just really good evidence that you've been successful in that part of your program and that you're competent.
Okay, but if you've just checked something off once and you haven't come across it again,
that's fine. And you
fine.
might not, right? There's some things that you might not, but the common things, so like controlled drugs prescriptions, child development assessments, make sure you've done those. The important ones, prenatal care, fetal hearts, fetal lie, things like that are all really important to make sure because those are the basics of primary care. Mm-hmm. Dana.
I just had a question. If you have, like, I have a specialty placement for up to 80 hours and then a primary care placement, do we require 2 clinical learning plans, or would we submit just 1 clinical learning plan and then have all your preceptors sign it, or how would I navigate that?
That's a good question. We usually only require one.
Oh.
So, but you may want to have a different goal to reflect what that specialty placement's going to be and review that for sure with that preceptor.
Okay, thank you.
Okay. Got a couple of minutes left. And again, the questions don't have to stop. Sue and Sherry and myself, we're all here. You can follow up with us at any time.
Lynn, I've done my best to try to keep up with questions in the chat.
Oh, good. I saw you flashing things by. Yes.
Yeah, but there are a few questions that I thought I might bring to your attention. First of all, can you speak to the cultural safety course and whether or not that you would approve that within 6, 7, 8?
No, we cannot do that in 6, 7, 8. That changed a couple of semesters back. So that needs to be 6, 7, 6 or 6, 7, 5 or 6, 7, 6.
And for MAID, what is the general policy?
So MAID is a big up and coming thing for nurse practitioners. And we've discussed that as kind of a, you know, an opportunity because it's happening in primary care a lot, that people are kind of becoming ad hoc assessors and maybe providers. I have many colleagues who do that as part of their primary care practice. It's not something that we're going to approve you for a preceptor for, you know, like a 40-hour quote unquote specialty placement. But, you know, if your preceptor does this, I'd be agreeable to have you do and count like a maximum of 40 hours doing specific MAID assessments you may want to observe, but you cannot provide without an NP license.
There's a couple of questions regarding changes to your clinical plan, and I'm sorry, I just realized I don't have my camera on. Sorry about that. The biggest thing, the most important thing for us is that we know about the change. Okay, so if you've submitted a preceptor request form and then subsequently your intent, your plans change, maybe the preceptor reaches out and says they're no longer available. Maybe the facility contacts you and suggests that you add an additional preceptor. Maybe you're going to take a semester off and defer for a semester. We need to know about that because in the background, Sherry and I are constantly working to process your clinical requests. And it really sucks not only to waste our time on a placement you don't need, but it also hurts our reputation, having to go back and cancel something or work really hard on something that you actually don't end up needing. So if between the time you submit a preceptor request form and, you know, the approaching term, if something changes, please contact us directly so that we can address those changes. We can edit your preceptor request form to reflect your current reality. That's super important. And, you know, these things happen. We certainly understand that. And we do our best to accommodate. One of the questions in the chat was whether or not you can change things halfway through. If you're in the middle of a term and you realize you're not going to be able to finish your hours in one term and you are going to have to extend to 2. If you have submitted a preceptor request form for the following term already by the deadline, then yes, we can make some adjustments, but it's not always possible, especially if you don't have that corresponding preceptor request form submitted. So there are certain things that we can change and modify and still make happen for you, but our hands are tied when it comes to things that are like deadlines that are imposed by external organizations. So we have to fit not only AU's rules, but also the rules of the facility and the organization at which you're requesting the placement. So there are sometimes situations where we can't accommodate, but your best bet is to contact us as soon as you know so that we can address that appropriately and discuss what the options actually are for you. Okay? So that was kind of an ending to Brittany Mott's question.
Yeah,
if that
and that was
helps. Yeah.
better detail. It kind of builds on what I kind of glossed by it earlier, so. Holly, so if you completed women's hours, yeah, any hours, anything after the 100 hours for women's health can go into adult. Yes. Okay, we have one more question because we're over time. So one more question.
It's me, Nargis.
Okay.
Yeah.
Why don't you put your camera on?
Oh, sorry. I'm at work and I don't know.
That's okay.
I'm
Hi.
Yeah, hi. But I think that's to address my question. I'm not sure. That is why I want to clarify with you. So today, I'm doing my 676 now. And then my plan is to finish 250 this semester for sure. I have a very nice family physician. He's very nice and he's very knowledgeable. And today I talked with him and he accepted me for spring and fall because my plan is 300 more divided to a spring and fall. But the problem is I didn't know that he's going to agree with that. That is why today I had, he said, yeah, absolutely, I can accommodate with you. And that is why November 1st, I didn't submit my form for the spring, actually. What I'm going to do now, because I really want to divide it 150 hours a spring, 100, because the next semester is going to be, I think that I have to more focus on my things. That is why. Now this is my situation. Today he said, yes, he's going to do that.
So that's a question.
You're going to come talk to me.
Yeah, take that. Yeah, no, that's the type of thing. Yeah, talk to Sue.
We'll talk about it for sure.
Thank you so much. Thank you.
Yeah.
Okay. All right. So thank you folks for coming. And I will dig out a copy of the CRNA, the competencies, and post them in the course. This will be recorded. I'll have to get our IT guy to make it all pretty in YouTube for me, but it'll be here for reference purposes. And you know who to reach out to. Please don't hesitate if anything comes up, because as Deb said at the start, our goal is your success and to support you as you get your clinical hours done through the program. Don't forget Wednesday, Deb is going to be leading a general town hall about all aspects of the NP program. You're welcome to come to that one. I encourage you to come and bring your questions. And I want to thank you for taking some time to come and talk with us tonight.
Thank you.
Good night, everyone.
Thank you.
Bye.
Thank you.